How often should someone with type 2 diabetes check blood sugar? So question, it depends upon the treatment plan. If you are on oral medication like metformin or SGL2 inhibitors, etc., usually once a day, a few times a week is good enough. The goal is to understand your fasting and post-meal blood sugar trend. Um, you don't have to micromanage every meal if your diabetes is under good control. But it's important to keep track of your blood sugar first thing in the morning and 2 hours after meal. That gives you an idea if medicine is working or not and how your body is handling the blood sugar surge after meal. So best time for testing is fasting before breakfast. It reflects overnight glucose control and your basal insulin production. Occasionally 2 hours after meal shows how well your body is handling glucose surges because of the input from your food, which is glucose, right? But if you are on insulin, especially short-acting insulin like Humalog, Novolog, something like that, then you need, and you're multiple injection, then you need frequent checks. And typically, you should check it before every meal and at bedtime. So that makes it 4 times a day, right? Sometimes even you have to check 3 o'clock in the morning to make sure that you're not developing something called nocturnal hypoglycemia, smoky effect. We're going to talk about that later. Now, if you are, suppose, using CGM like Libre2 or Dexcom, that continuous glucose monitoring, that gives you a real-time trends, makes it easier to adjust insulin diet and exercise. And then focus will shift from how often to the trending and interpretation and the patterns and variability and time in range we're going to talk about in different videos. So you'll see a series of videos going forward. It's going to be all geared towards diabetic patient because I want you as a diabetic patient to know everything there is for you to know. And you're going to be smarter than most of the people who don't know. So this is all about making you smarter about your diabetes control. So in next video, I'm going to be talking about sliding scale of insulin, what it is and how to manage that.